Okay, so these are the verbal findings on the physical assessment, the head to toe physical assessment. Um, the patient was awake, alert, and oriented to person, place, and time and situation. The patient was able to express his concerns. He stated his appetite has been good and his weight appeared normal for his age. He appeared to have a forward astute posture when sitting, but sat comfortably in the chair and on the table. The patient ambulates independent. He was able to maintain balance with a steady gait. His walk was smooth and even. He exhibited no physical signs of abnormal movement effect. He was comfortable and cooperative. He appeared clean and groomed appropriately for his age. His articulation was clear and understandable. The skin color tone was even, brown skin, and intact with no obvious lesions, unblemished, with no presence of any foul odor. The client had light brown nails and had the shape of convex curve. It was smooth and intact with the epidermis. The capillary refills was less than 3 seconds, and he had good skin turgor. His head was normocephalic and symmetrical. No nodules or masses and depressions were present. The scalp didn't have any lesions or pest inhabitants. There was no tenderness when palpated. The face of the client was symmetrical. It appeared smooth and had uniform consistency. His temporal arteries were strong and palpable. His facial sensations were intact, and the cranial nerve 5 and 7 were intact. The maxillary and frontal sinuses were normal when palpated. The body parts were equal and bilateral, and they were relative proportionally to each other. There were no lumps or pulsations on the neck. No pain or tenderness expressed during palpation of the lymph node areas that were non-palpable. The carotid artery was strong and present. The trachea was centered and movable. No swelling present. The shoulder and neck muscles were strong. So the cranial nerve 9 was intact. Cranial nerves 3, 4, and 6 controlling the eye movements were all intact. The bulbar conjunctival appeared transparent with fluid capillaries evident. The sclera appeared white. The cornea was transparent, smooth, and shiny, and the details in the iris were visible. Pearla was present. Overall, external with the eyelashes, eyebrows, and eyelids were all normal in appearance. The auricles are symmetrical and had the same color with his facial skin. They were movable and movable, firm and non-tender. The pinna recoils when folded. He was able to hear whispered words and recall them, so his auditory cranial nerve 8 was intact. The nose appeared symmetrical. His nose appeared symmetrical, straight, and uniform in color. There was no presence of discoloration or flaring. When lightly palpated, there was no tenderness or lesions. The nasal septum was centered, and the cranial nerve 1 was intact because he was able to smell the coffee grinds and was able to identify it. The lips were uniformly pink and moist and had smooth texture. There was no discoloration of the enamels, no retraction of the gums, and the gums were pink in color. The tongue of the patient was centered. It was centrally positioned, pink, moist, and slightly rough. So the cranial nerve 12 was intact. The smooth, soft palate were light pink and smooth, and the hard palate had a more irregular texture to it. The tonsils were normal in size, and the uvula was positioned in midline of the soft palate. So cranial nerve 9 and 10 were intact. The thyroid gland, it was non-palpable. The patient demonstrated quiet, rhythmic, and effortless respirations. The lung sounds were clear and present in all lung fields. Normal breath sounds were heard throughout. There were no visible pulsations upon the aortic and pulmonary area. No heaves or lifts present. The apical pulse was strong and felt at the fifth midclavicular line at the intercostal space. The abdomen was symmetric in ball and contour. The bowel sounds were present in all four quadrants. The umbilicus was centered, and resonant sounds were heard throughout all fields of arm percussion. The extremities were symmetrical in size and length. The skin was normal in color, the same with the rest of the body, and the hair was distributed evenly. I was able to palpate all the pulses in the lower extremity, present on both sides. The muscles showed smooth and coordination movement, good abduction, adduction, internal and external rotation. Upper extremities had good range of motion. The patient displayed no swing or loss of balance during the Romberg's test. His patellar reflexes were present, and the spine had full range of motion with no abnormal findings. His overall appearance was healthy, and overall everything was good. So this concludes the physical assessment.